Paul. Okay.
Good evening. Welcome to the meeting of the Skokie Village Board for Monday, July 20th, 2020. Before commencing the meeting, I'd like to make a statement of explanation. Until further notice, meetings of the Skokie Village Board will be held electronically, with the majority of village officials participating via remote access in order to comply with the state of Illinois stay-at-home order. Members of the public who wish to comment as to an item on the published agenda or to comment during public comments should submit their statement or question in writing to the village manager's office. All properly submitted statements or questions will be presented and read during the relevant portion of the meeting. Written comments may be submitted by email to citizencomments@skokie.org, by mail to the Village of Skokie, Village Manager's Office, 5127 Oakton, Skokie 60077, or via the village's drop box located by the public entry to Village Hall. Now, it's my pleasure to introduce Village Clerk Pramod Shaw to lead us in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, with liberty and justice for all. The clerk will please call the roll.
Trustee Roberts.
Here.
Trustee Sutker.
Here.
Trustee Ulrich.
Here.
Trustee Bromberg.
Here.
Trustee Klein.
Here.
Trustee Gray Keeler.
Here.
Mayor Van Dusen.
Aye, the motion passes. Next item on the agenda is approval of the consent agenda for this evening's meeting. Motion is in order. Trustee Gray Keeler, seconded by Trustee Bromberg. Call the roll, please.
Trustee Roberts.
Aye.
Trustee Sutker.
Aye.
Trustee Ulrich.
Aye.
Trustee Bromberg.
Aye.
Trustee Klein.
Aye.
Trustee Gray Keeler.
Aye.
Mayor Van Dusen.
Aye, the motion passes. And I apologize. I should have asked if there was anything on the consent agenda anybody wanted removed. If not, thank you. Next item is report of our village manager, John Lockerbie.
Thank you, Mayor Van Dusen, and good evening. Item A is regarding the COVID-19 update. I've invited Dr. Kennard, our Director of Health, to be with us this evening to provide the most up-to-date information regarding COVID-19. And as Dr. Kennard is approaching the podium, I wanted to mention that she has accepted a new position as the Medical Director for the Illinois Department of Public Health. Her last day with the village will be Friday, August the 14th, and she has served the village with distinction for the past 11 years. And although we will miss her, we wish her luck, continued success, and are proud that she will be now advocating for all residents within Illinois. And so with that, Dr. Kennard, we will miss you and appreciate all the service that you've provided to the community. And we'll turn it over to you for COVID-19.
Thank you, John. And thank you. I just wanted to say that this has been an extraordinarily rewarding and meaningful time for me. When Mr. Rigoni, the previous village manager, hired me, he asked me to stay 5 years, and I've doubled that, more than doubled. So clearly I was very, very happy to be here and so impressed with you, the trustees, and with Mayor Van Dusen, Mr. Lorge, everyone in the village's overwhelming support of all of our public health initiatives, of course our Board of Health. So it's really been a wonderful experience, and I'll still be part of the public health fabric just at the state level. So of course I'm sure you're not getting rid of me that easily. I'll still be around, but thank you, and thanks for giving me the opportunity to work with all of you here. It's really been terrific. So I will get us up to date on where we are with COVID-19 today. I'm pleased to be here tonight to give you an update on the COVID-19 situation in Skokie. As of today, as you can see here, the COVID-19 data continues to be reassuring, and there continues to be overall very good compliance with measures to control the spread of the virus in the village, such as staying home when ill, social distancing, and wearing face coverings in public settings. There's not been an increase in COVID-19 cases in Skokie since moving into Phase 4 of the Restore Illinois plan on June 26th. We do, however, continue to identify a few new cases each day and must remain vigilant to ensure that we keep the virus in check as we reopen our community. As you can
This guy
see
called.
here,
He said that his car is in our parking lot and that he doesn't have a key for it and that he has to leave it here overnight. And he's trying to get someone to open the...
okay.
Welcome to the meeting.
Okay, so here's our daily case count graph, and our cumulative totals are at the top, and you can see that as of today, 1,057 Skokie residents have tested positive for COVID-19. Of these, 987 or 93% are recovered or recovering, which means that they are not in the hospital and no longer in isolation. 35 residents are still ill in isolation, and there are 5 people in the hospital. Unfortunately, since I last spoke to you 2 weeks ago, we've lost another resident to COVID-19, someone who is living in the community and not long-term care, which brings the total number of deaths to 35 since March 14th. Our most sincere condolences to the families and loved ones of those who have died, who were valued members of our community. Can you go to the next? Thank you. There are quite a few metrics being followed now to ensure that we quickly identify areas that are beginning to get into trouble and take mitigation steps to get back on track if needed. The metrics track new COVID-19 cases or infection rates, test positivity rates, number of hospital admissions, and hospital bed availability, including ICU beds. Quoting from the governor's office, as states across the country experience a surge of new COVID-19 cases, Illinois remains an outlier with lower hospitalization and infection rates and one of the highest rates of testing in the United States. The state is in its strongest position to combat the virus since the pandemic began, with a robust testing program giving 30,000 tests each day, or more than 2 million tests thus far, expanded contact tracing operations, a growing stockpile of personal protective equipment, and hospital surge capacity. That's in the safe range. But we need to be attentive in order to maintain the progress the state has made towards bending the curve over the last 4 months. It is remarkable that thanks to the hard work of everyone in Skokie, the COVID-19 case rate or new infection rate in the village on average over the last 7 days has been less than 5 per 100,000. And the test positivity rate, as you can see here, was at 2% last week. This is in contrast to suburban Cook County as a whole, which had a case rate of 54 per 100,000, and Chicago, where the case rate increased to 63 per 100,000 during the same time period. Unfortunately, the increase in Chicago cases has been related to people not following the rules by gathering in large numbers, especially in bars, not social distancing, and not wearing face coverings. Because of the uptick in cases, you may have heard today on the news that Mayor Lightfoot has announced that restrictions on bars, restaurants, gyms, and other businesses will be reinstated this Friday, July 24th, as a precautionary measure. In addition to the county level metrics, on July 15th, Governor Pritzker and the Illinois Department of Public Health released a new mitigation plan that further divides Illinois into 11 regions. So that's the map, Alex. From the 4 we had previously, to allow a more focused approach to each area's coronavirus response as the pandemic continues. These regions are loosely based on emergency medical service regions, and Skokie is in Region 10 with the rest of suburban Cook County. If the indicators for our region show an increase in COVID-19 disease burden or cases with a simultaneous decrease in hospital capacity, or if there are 3 consecutive days averaging greater than or equal to 8% test positivity, then additional mitigation steps will need to be taken, as is being done in Chicago, to prevent the uncontrollable spread of disease. This is a tiered approach, beginning with reducing capacity limits and indoor activities and ending up back to having only essential businesses open. One step being taken by both the Chicago and Cook County Department of Public Health, which we're not implementing here in Skokie, is a 14-day travel-related quarantine for people who've been in states where the number of COVID-19 cases is on the rise. There are no plans to require or recommend quarantine in Skokie at this time, consistent with the stance of Governor Pritzker. If the situation changes based on new data, or, of course, if there is an Illinois-wide directive issued, then we'll revise our position. Any business, school, or other entity that wishes to require a 14-day quarantine for their own employees who have traveled is able to do so. There's no prohibition on that action. But my conversations with Mr. John Lockerbie and Mr. Lorge, we think that the more important messages are that everyone should stay home if sick, maintain social distancing, and wear face coverings in public settings, wash our hands frequently. This is true no matter where a person is. Simply spending time in another state without engaging in risky behaviors would not be expected to increase your risk of COVID-19 infection. On the other hand, as we're seeing in Chicago, and it could happen in Skokie too, in our area, anywhere where there's new cases of COVID-19 being identified nearly every day, if you participate in large gatherings, do not social distance, or wear face coverings, well, then you've substantially increased your risk of infection. The other crucial aspect of our response, as I've said previously, is engaging with all sectors of the village, especially houses of worship, schools, child care centers, the Park District, library, and businesses to comply with the Restore Illinois Phase 4 guidelines for safely reopening. Here is the 63-page Illinois State Board of Education draft guidance for starting the 2020-2021 school year, which will be finalized in the next few weeks. Guidance was recently issued for school athletics, so the health department has been working closely with schools to begin summer athletic programs. The Economic Recovery Task Force has been working diligently to meet the needs of Skokie businesses, and we'll have a final economic recovery plan in place by the end of the month. And I want to tell everyone in the community that we're here for you. No question is too small, and you should not feel alone. Whether you're from a condo association wondering about reopening the swimming pool, a Little Bit League baseball team asking for guidance, a shop, a salon, someone wanting to have a garage sale or a block party, we're here to help you and to keep you safe. So finally, we would like to extend our gratitude to the Skokie Community Foundation for donating $55,000 to provide relief for Skokie residents who've been negatively impacted by a reduction in hours or job loss during COVID-19. This has allowed the Human Services staff to support more than 100 families with rent, mortgage, and utility assistance. So overall, good news. We're of course aware that COVID-19 has not gone away, and we cannot waver during the coming months to prevent a resurgence in cases in the village. Until we have a vaccine to prevent illness, perhaps by early next year, we need to continue to stay home, get tested if we have symptoms, stay home when we're sick, get tested if we have symptoms, wear face coverings in public, keep 6 feet between ourselves and others, and wash our hands. And I want to thank everyone from every department in the village again for assisting with this huge effort. As I said, Mr. Lorge, Ann Tennis, Nick Wyatt, John Lockerbie, Mayor Van Duzen, all of you, the elected officials, businesses, and other entities, citizens in Skokie, for facing this unprecedented situation together. And congratulations to all of you for a job well done. Thank you, and I'll take any questions that you might have.
Okay, are there questions? I don't see everybody.
I see Trustee Roberts' hand up.
Trustee Roberts?
First, Dr. Kennard, I just want to say thank you for your service to our community. I think you brought us to a new level of public health service. to our residents, and I deeply appreciate what you've done. And
Thank you.
I'm happy to see that, and I hope you'll continue to look over Skokie in your new job at the state level.
Absolutely.
So my question tonight, I have two questions. First is, how many contact tracers have we hired, and how is it working out? And do you have any overall major findings of what they're finding, of what are the primary sources of COVID, or how people are getting COVID?
Yes. So we have, what the approach that we've taken is, we had a part-time nurse we made full-time to help with this effort. We've hired a nurse full-time from the Medical Reserve Corps. We also have, we're primarily focusing on Medical Reserve Corps, Skokie residents, some people from within the village, infrastructure already, the village of Skokie, and then because they're all handling different aspects of this response. And then really trying to get members of the community who speak many of the languages, such as Urdu and Hindi, Arabic, and so on.
Great.
So we have Beth, for Human Services, we've hired 2 social workers because we want to make sure, first off, that people can stay home. If we say you're ill and you need to stay home, do you have your kitty litter, I think I mentioned before, or whatever the supplies are that you need, so that you don't have to go out. And then, so 2 social workers, we made our part-time nurse full-time. We've hired another nurse full-time from the Medical Reserve Corps, and 2 of Matt Brandmeier's community development staff inspectors, Colleen Burke and Jim Duesenberg, are going to be spending half time working with the environmental health team, because really we are getting a tremendous number. You know, there's 2,000 businesses, as you know, or more than, in the village. We're getting a tremendous number of questions about all the different ways of doing business in the village, and how do we make sure that both the employees and customers, if they're public facing, are safe. And that's been a tremendous effort. Right now we have 3 graduate students from the UIC School of Public Health helping us with different aspects, whether it's outbreaks and working with the businesses, creating tables, also all of our data analysis they've been working on. And then in addition to that, we have hired, I'm trying to remember, it's a very interesting situation I mentioned last time. Our usual staff are at home doing, answering the phone and doing other aspects of their jobs, and we have all these new folks. So we have hired 3 other contact tracers who, again, speak multiple different languages and have been, everyone is tremendously talented and helpful. We had over 130 applications. We were planning to hire 9 people altogether, and so basically that's where that's the amount of money that we received that we'd be able to do that. So what we have been seeing in the past, we really, you know, I did ask if we had any, in the last month, I did ask our data analysts if there had been very many people who had traveled to hotspots and come back, and it seemed like that was related to their, as the source of their infection. And we just had a handful of people. You know, there were a couple of kids who had gone 20s and gone to Florida maybe, and then out at the beach or so on, but that just hasn't really been an issue here, if that's what you were wondering. We're still seeing people who are working in essential businesses, not necessarily in Skokie, but in the region, and then having household transmission. But you know, we're down to just a couple of cases at a time, and sometimes we don't even really know where the person might have gotten their infection. But it's circulating out in the community. Last time I spoke about how we had been seeing cases in long-term care and so on. And I can have, Sue was off today, Sue Reesberg, but if you'd like to hear about the long-term care response next time, we can. So it's just multifactorial. We really haven't seen a surge of increase, and I think that it's because everyone's doing a great job. Hopefully it answers your question.
Yeah,
It's kind
and,
of a long
yeah.
answer there, but we tried to
No,
target the different areas of the, that we're working on and hire appropriate people for those to take on those functions.
No, I appreciate it. I think we would appreciate hearing from Sue Reesberg, but and I appreciate the fact that our new employees are multilingual and can reach members of our community.
Right.
My second question was based on my own recent experiences with extended family and friends who have come down with symptoms. I've seen people getting tested and not getting their results for more than a week. That seems to be a real Achilles heel in our system. If you can't get rapid results, particularly if you're not careful and you're going back to work or don't, if you're negligent in how you behave after and until you get a result back, are you satisfied with what you're seeing, or what can we do about getting more rapid and accurate testing?
Well, I'm encouraging everyone to go to North Shore because we get those tests back consistently within a couple of days. So you're correct. We have seen people, they've gone to their doctor and had a test done somewhere else, and it can take a long time, and that does really hinder the public health response because, even as an employer, how can you, if one of your employees was ill and now it's going to be 10 days or a week before you get the results back, can you really have all the employees who might have been exposed be off work all that time in quarantine?
Yep.
That's one reason. I did want to mention this, and I didn't do it when I was speaking earlier. I think we have to be careful to make sure people realize that isolation is for people who are sick, to make sure they stay away from others, and quarantine really is for you have been exposed in a way that we think you might get sick to someone whom we know has the disease. So, putting out a quarantine order blanket that anybody from Tennessee or any of these other statements, I think starts to muddy the water a little bit. And we should be careful about that. So when I'm calling you or someone from the health department is calling to put you in quarantine, it's because we know you were exposed to someone. But we have not had, if people are getting tested at North Shore or they're getting tested at NTL Laboratories in Skokie on Skokie Boulevard, or the private lab that's in town, we haven't had any issues with getting back the tests in a timely manner. And North Shore can do 1,500 people a day. So that isn't a challenge here. In other areas, they're still struggling to get access and to get testing back quickly.
Any other questions? Trustee Gray-Keeler.
Not really a question, Dr. Kennard. I just want to thank you so much for your leadership and expertise, starting off with what you've done and then ending up with the COVID-19. It's just wonderful knowing you're in charge, and wishing you well in your next endeavor, and so glad it's going to be in Illinois overseeing us. Thank you.
Thank you, Trustee.
Trustee Klein.
Hi, Doctor. Just a quick question, following up on what Randy was talking about. I had a family member who took a test recently and they gave immediate results. They said the immediate results were 90% accurate, and then they, I guess, processed the test further, and in 2 days they give them the final results. Are these tests available, these immediate result tests, or is that a special thing?
Yeah, no, they are, it is confusing, isn't it? They are available, not widely available, they are becoming available. We did have a discussion about this with the state of Illinois this morning, local health departments, and those are, if you get a positive test, you can be confident in that. It's the negative tests are more of a challenge regardless of the testing. So what we've done, if we've had someone who really seemed like they had all the symptoms and they had a negative test, is we've recommended they get another test done. Because if you have 2 negative tests, then it's much less likely that it's not inaccurate. So yes, those tests, get tested if you can. But I would, here in our area, I would get in with North Shore. They're very readily accessible and happy to serve the community. Right over
Good.
on Woods Drive, yeah.
I'm saying, but to follow up on what Randy said with the time, are these tests available in Skokie, these immediate response ones?
Not that I've seen, but I can follow up with you on that. And I know that there was some discussion, as I said, on the call this morning, but I haven't seen that. The ones that are being done at North Shore are the usual PCR swab up into the deep parts of your nose. So that's what they're doing over there. The same one they've been doing all along.
Okay.
Is that what you meant? And that's what's being done at NTL Laboratories.
Which takes a couple days.
Right. And then we get the results back in about 2 days.
Okay. Thank you, Doctor. Thank you for everything, too.
Sure.
Trustee
And
Sucker.
before you leave, can I remind you that 4 blocks from Village Hall, a brew pub is opening, so you may not want to leave.
Yes, it's already said I'll be back.
Good.
But
Trust-
I'll follow up and see if anyone is doing the rapid test. Not that I know of, but I'll check and see if anyone. I don't know that we've gotten any results like that, because when we get the test result, we get both positives and negatives. That's how we figure out the test positivity. We know what test that was done. And I'm not aware that we've seen any of those cross our desk, but I can check on that tomorrow and give that information to John and let you know if anybody's doing those kinds of tests here.
Okay.
Thank you, Doc.
Trustee Sucker.
Hi, Dr. Kennard.
Hello.
I want to echo what everybody else said, that I've really cherished having you as a leader in this community. It really helps the integrity of the work that we do. So I do wish you the best, and I'm glad you're going to stay in Illinois. And my question is, do we have any new information about the antibody test that North Shore is doing? Like, has it shown anything to us? Has it given us any information about how many more people have really been exposed than have tested, or
I did
or
look at
not?
that, and the test positivity for the PCR test overall has been 25%. That's the nasal test that I was telling you about, but antibody test is hovering about 5% positive. And I've heard from many people who could have sworn they had it, or, they're kind of mixed feelings. Kind of glad they didn't have it, but kind of wish they would have. I'm just joking. We don't want to get it, but 95% negative. I did look at that data yesterday. So they're still running at 95% negative on the antibody.
And will you still come to the meeting in August also?
Yes,
Okay, good. Thank you.
sure. I'll be back in 2 weeks. And I'm here until August 14th, as John said. If you have any other questions.
Doctor, thank you.
You're welcome.
We'll see you one more time at least.
Yes.
Yes.
Item B is regarding an intergovernmental agreement between Oakton Community College and the Village of Skokie to establish a community apiary. The Village of Skokie and Oakton Community College are partnering to establish a community apiary on the OCC, or the Oakton Community College Skokie campus, to celebrate beekeeping and provide a communal beekeeping location for Skokie residents who are not able to or would prefer not to use their own property for this purpose. The proposed site is on the east edge of the Oakton campus parking lot in a secluded corner with abundant vegetation. Oakton Community College will oversee construction and be responsible for any future maintenance. The Village of Skokie will conduct yearly inspections and ensure compliance, as well as investigate any complaints. Oakton Community College will construct the apiary over the next few months, utilizing grant funds, with the hope that beekeepers will be able to begin using the facility in the spring. I concur with staff's recommendation and respectfully request mayor and board approval of a resolution authorizing the Village of Skokie to enter into an intergovernmental agreement with Oakton Community College for the purposes of establishing a community apiary. And I should note that Dr. Kennard has been the leader on this project for the village, and she is here if there are any questions.
A motion on the intergovernmental agreement with OCC is in order. Trustee Gray Keeler, seconded by Trustee Roberts. Are there any comments or questions? Trustee Roberts.
Are there adequate grant funds to construct the apiary, get it in operation?
Yes, I was notified they have $15,000 from, I believe it's the Oakton Community College Foundation to get this off the ground. This is, I just wanted to say, this was an amazing, for 7 years. Bruce Jones and I, along with many others in the community, have been looking for an appropriate location. And in the memo here, it included the Talking Farm, the Skokie Park District, Emily Oaks, Metropolitan Water Reclamation District, Niles West High School, and of course Oakton Community College. And we've consulted with the Chicago Botanic Gardens, the Illinois State Beekeepers, Skokie Beekeepers, other community experts such as Naaman Gamble, who owns the Hive Beekeeping Supply Company, and Mr. Jones and I also took Beekeeping 101 from Mr. Gamble at the Garfield Park Conservatory. So I think it's just been a tremendous example, again, of real community commitment towards sustainability and towards the importance of beekeeping, recognizing the importance of beekeeping, but also our ability to collaborate and work together. Mr. Lorge, like usual, has been very helpful in this, as has John Lockerbie. So Max Slankard and also Deborah Protzman from Risk Management. It's been quite the endeavor.
Thank you for your efforts.
Yes, so
Okay,
did you want to see, should I put up a picture of what the vision is for it? I have those images.
I also have citizen comments
Yes.
regarding this topic.
Okay.
And so if you want to put those up while I comment, Dr. Kennard, that would be fine. But we did receive 28 citizen comments regarding this topic. All of them are in favor of the community apiary. I'm going to list off the names and those that provided addresses. Pam Coffrey, Kathy Larson of 8115 Colmar, Bob Cusell, 7654 Tripp, Kelsey O'Connell, the 7900 block of Kilbourne, Tony Yarzagari, 4329 Suffield Court, Elizabeth Dostert, Daniel and Mara Lazar, Catherine White of 5001 Golf Road, Pam Sloan, Larissa Turin, Todd Hensley, 8540 Kedwell, Elaine Perry, Nikki Antonokis, 7451 Kilbourne, Linda Metrick, 8232 Niles Center Road, Laura Bird, Paul Reichelt, W. John Nixon, 5458 Greenleaf Street, Mary Lou Wojtek, 7851 Kilbourne Avenue, Jerry Spiratus, Jan Bellotti, Howard Sproul, 8649 Niles Center Road, Jan Coral, 9007 Costner, Beverly Pines, Kerr, Robin Frey, Nicole Martinek, 9322 Tripp, Mike Oster, John Unwin, 4420 Davis Street, Melina Kelson, and that completes the citizen comments.
thank you.
Alex, can you show the image, I think? Just of the beekeeping. So this is the location that we're talking about, and it's in the back of the parking lot of Oakton Community College, right by, you might see Skokie Boulevard. And there is the labels aren't showing up, but there is a basketball hoop that's encircled there. You know, this is not too far from where it joins over to the multi-use path that's going along that direction. So there is a basketball hoop that will have to be relocated, but there's adequate water because there's retention ponds right across to the west of it. It is not going to be as big as that. We're talking about 30 by 50 feet, and that's a much larger triangle than that. So I think we've managed to find a perfect location with plenty of wildflowers, water source in the area, and it's out of the way. And then if you could show us this is from Pittsburgh, so it's gonna have a solid fence around it. What I'm more concerned about is someone messing around with it, like kids, you know, so it is out of the way. There will be a security camera there, and there's going to be signage on the fence for safety, identifying that there's bees in that area. But there will be 20 hives, 2 per beekeeper, and then there's one more just like from above, but it will have a solid fence around it. So that's this is Pittsburgh. You can see it's right in a residential neighborhood, and so that's the vision for this. And I'm really excited about it. I think it's a great opportunity for the village.
The clerk will call the roll, please.
Trustee Roberts,
Aye.
Trustee Sutker, can you unmute?
Edie?
No, she's muted.
I said aye.
Oh, okay.
Thank you.
Yeah.
Okay.
Trustee Ulrich, Trustee Bromberg,
Aye.
Trustee Klein,
Aye.
Trustee Gray Keeler,
Aye.
Mayor Van Dusen.
Aye, motion passes. Before we proceed, I just want to clarify something for the record. Trustee Ulrich is coming to us by her phone this evening. So you'll see at the very bottom of the screen a phone number. That is Trustee Ulrich's. There was a computer snafu this evening, so if anybody was wondering what was going on, hopefully that will help explain it. So, John?
Item C is regarding the water rate ordinance for fiscal year 2021. For FY 2021, a 3% increase is recommended to fund all water-related activities for the coming year. Even with the rate increase, Skokie's water rate remains the second lowest among area municipalities. The impact of the recommended rate adjustment would result in an average residential monthly increase of $1.52. I concur with staff's recommendation and respectfully request mayor and board approval. Julian Prendy, our Director of Finance, is with us this evening if there are questions. The final ordinance will be brought before the board at the August 3rd meeting for final consideration.
Okay. A motion on the water rate, Trustee Bromberg, seconded by Trustee Sutker. Are there any comments or questions? Being none, the clerk will call the roll, please.
Trustee Roberts,
Aye.
Trustee Sutker,
Aye.
Trustee Ulrich,
Aye.
Trustee Bromberg,
Aye.
Trustee Klein,
Aye.
Trustee Gray Keeler,
Aye.
Mayor Van Dusen.
Aye, the motion passes.
Item D is regarding a commercial corridor storefront enhancement program grant. It's the 3938 Dempster Street location, which is affectionately known as the Grecian Kitchen. Harry and Steve Ikasdakis are with us this evening, and I apologize for the pronunciation of your last names. But this is a longtime Skokie-based business and family-owned restaurant. They have applied for funding under the Commercial Corridor Storefront Enhancement Program. The brothers have owned and operated this iconic eatery since 1996 and have undertaken various investments within the structure and site over the past 15 years To further accommodate their customers during the COVID State of Illinois Phase 4 guidelines and beyond, the owners are seeking to invest in their restaurant by improving the outdoor dining experience and by modifying their interior serving and dining areas. The majority of the interior and exterior work to be completed includes the construction of a new outdoor patio and structural roof, decorative stonework along the base of the building, new exterior facade including new columns and windows, exposed ceiling, remove, drive it, and replace with new brickwork, new paneling and floor tile, countertops, new built-in beverage stations, lighting upgrades, and signage enhancements, among other eligible costs. The applicant has received several bids for the major components in the interior and exterior work. The lowest estimate for the work to be done totals approximately $156,500. Of that amount, $40,000 is deemed eligible for reimbursement with maximum architectural fees of $3,000. The total grant will not exceed $43,000, which would be transferred to the owner following the completion of all the work, final inspections, and submittal of all required documentation. Mayor and board approval of a grant in an amount not to exceed $43,000 is respectfully requested for Grecian Kitchen located at 3938 Dempster Street. And Leslie Murphy, our economic development specialist, has been working with Grecian Kitchen regarding these improvements.
A motion on the commercial corridor storefront enhancement grant for 3938 Dempster is in order. Trustee Sucker, seconded by Trustee Klein. Are there any comments or questions? Trustee Roberts.
I just wanted to ask the owners quickly, if I could, and well, first of all, to the owners, thank you for investing in your business and investing in Skokie. Could you just, I'm just curious how business has been for you and what some of these improvements will help you do with your property and your restaurant to better serve your customers in these difficult times for you.
Well, thank you again for, it's been for like 24 years right now, so it's been great. Business has been going pretty good. I think we've adjusted on the fly as far as trying to, with all the recommendations and how to handle the COVID. But deliveries have been good. The to-go carry-outs, curbside, increased a lot. Taking orders out to the cars. And then the other thing is we're like sanitizing like crazy. Everything is, spray bottle and towels and cleaning up everything all around. What I think if we fix up anything is it will be able just to clean up everything. Tables will be, like our tables right now are wooden. We'll probably try to get some kind of tables that are easier cleaning, that doesn't hold, it's easier cleaning, I guess, so it won't be contaminated easily. That's all, just kind of freshen everything up. We want to try to get in with a new look of the restaurants, now more modern look, and that's it, I guess.
If I can just add, it's been a true pleasure working with Grecian Kitchen during this time because they have been operating all through COVID. They've been doing a terrific job letting us know about their hours and what has specials that they've been offering. They've been working with the chamber to offer special family meals and holiday meals. Our family actually ordered the Easter package from Grecian Kitchen, and we were so pleased with everything. And that was back in April. So they've just been doing a terrific job throughout COVID. And it's just been a pleasure to work with them. They've been giving me all the information I needed in order to make this recommendation. So excited to see what they're going to end up producing at the restaurant.
And all the customers are very excited to see outdoor dining right now. Everybody's very excited.
Yeah.
Everybody's been talking about that. We're getting more outdoor dining now than the indoors. Now, granted, they might still be a little bit scared, but everybody's more excited about going outside and sitting. So that's a nice little excitement happening there, especially if we can make a nice little decor all around, make it a little bit more comfortable and pleasant to the eye. And I think it'll dress up Dempster too, a little bit better.
Yep. Great.
Thank you. Call the roll, please.
Trustee Roberts,
I vote aye.
Trustee Sutker,
Absolutely, aye.
Trustee Ulrich,
Aye, definitely.
Bromberg,
Aye.
Trustee Klein,
Aye.
Trustee Gray Keeler,
Aye.
Mayor Van Dusen.
Aye, the motion passes. Congratulations.
Thank you. Thank you. Make you guys proud.
Welcome.
Thank you.
That's a hard act to follow. We all look forward to Grecian Kitchen and their improvements. But item E and item F were approved under tonight's consent agenda, and that completes my report this evening.
Thank you. Next item on the agenda is report of our Corporation Counsel, Michael Lorge.
Thank you, Mayor. Good evening, everyone, trustees. I'm joined tonight by Assistant Corporation Counsel Barbara Mangler. Items A, B, C, and D are ordinances which were on the consent agenda at the beginning of this evening's meeting and were adopted at that time. Item E is a resolution on the agenda for first reading and board action tonight. The resolution will authorize the village manager to execute an intergovernmental agreement on behalf of the village with the Niles Township Government Board, which will allow the Niles Township Board to begin composting of food scraps from the food pantry which it operates. The composting operation will require approval from the Village of Skokie Health Department and Property Standards, and will require the same standards as our residential composting program, which has been successful. The Niles Township Food Pantry serves the residents of the township, including Skokie, and provides important nourishment to those in need. The township's highly regarded food pantry is continuously in receipt of a very large and unfortunately inconsistent flow of perishable foods. Much of the leftover food scrap waste can be composted to nourish the soil and conserve water. The township has a uniquely significant need for a sustainable way to dispose of this excess food supply through on-premise composting. The village is deeply committed to sustainability efforts and has encouraged residential composting and other environmental programs and measures which impact the community favorably. This would be consistent with such programs.
A motion on the intergovernmental agreement between the Village of Skokie and the Niles Township Administration for the establishment of a composting program is in order. Trustee Klein, seconded by Trustee Gray Keeler. Are there any comments or questions? If not, call the roll,
Roberts,
please.
Aye.
Trustee Sutker,
Aye.
Trustee Ulrich,
Aye.
Trustee Bromberg,
Aye.
Trustee Klein,
Aye.
Trustee Gray Keeler,
Aye.
Mayor Van Dusen.
Aye, the motion passes.
Thank you. Item F is an ordinance on the agenda for first reading tonight. The Skokie Park District serves our community as a hub for a wide range of events, from weddings and other private parties to organized entertainment for every demographic group in the village. The Skokie Park District has requested permission to permit the consumption of alcohol on its properties to enhance its ability to offer rentals and other programs. Although the state statutes permit the sale of alcohol in buildings and on golf courses owned by park districts in the state, Currently, the Skokie Village Code does not. This ordinance will add another classification of license for the district, a Class H, which will allow for the sale of alcohol at Park District buildings and its golf course. The license will have a nominal cost of $200 per year. This matter will be on the August 3rd, 2020 agenda for second reading and adoption, unless there are questions at this time.
Are there any questions?
Then that would conclude my report for this evening, Mayor.
Thank you. The concluding item this evening is citizen comments. John?
I have, excuse me, I have reported all the citizen comments that we've received.
Thank you. A motion to adjourn, I believe it's trustee Roberts this evening. Trustee Bromberg got her hand up first. Roberts seconds it. Unless there
Go ahead.
are any objections, we are adjourned.